kind of like this. Jess is a little cute today. Okay,
Okay.
action.
On September, that was a mistake. On August 31st, an innocent little girl began her fight against langerhans cell histiocytosis. This is Raina. She is the little girl that got diagnosed with this ugly disease. Aaron, her father, noticed Raina wasn't moving her arm the morning of the 30th. She was in pain. Aaron and her mother, Laura, called the doctor, and the doctor wanted to see her the next day. The doctors did x-rays, and nothing was wrong. They couldn't find anything on like the x-rays. They said if she wasn't better by the 3rd to bring her back. Well, on the 2nd, she started running a fever of 103. So they called the doctor, and all the doctor said was that it was probably just viral, but to watch her arm still. By the end of my speech, my coworkers will be able to tell me why the doctors thought Raina's condition was only a bone pain at first. Langerhans cell histiocytosis is similar to cancer, but there are a lot of differences between the two. According to www.histio.org, histiocytosis was first described in medical literature in the mid to late 1800s. Langerhans cell histiocytosis wasn't introduced until 1973. Langerhans cell histiocytosis is the most common histiocytic disorder. The Langerhans cell histiocytosis is also known as histiocytosis X. According to Bauer, Langerhans cells are immature dendritic cells on the skin. The cells carry surface receptors for immunoglobulin. Each class of immunoglobulins play a different role in the immune system. According to www.histio.org, Langerhans cells are a type of white cell that normally help the body fight off infections. With Langerhans cell histiocytosis, the body is overproducing Langerhans cells, causing the body not to be able to fight off infections very easily. In the part of the body where there are too many too many Langerhans cells built up, it can cause a tumor, or the organs can be damaged. The tumors that can be formed are called granulomas. The cause of LCH has not been determined yet. LCH is not a true cancer, it is not contagious, and it is not inherited. Some people who have Langerhans cell histiocytosis may not even know they have it. In some cases, LCH doesn't have any symptoms, or the symptoms can be brushed off as an injury. According to www.hr.nlm.nih.gov, other symptoms and signs that may occur in Langerhans cell histiocytosis, depending on the organs and tissues that have Langerhans cell deposits, include swollen lymph nodes, abdominal pain, yellowing of the skin or the whites of the eyes, delayed puberty, protruding eyes, dizziness, irritability, and seizures. A lot of tests have to be done to determine if someone has LCH. To make sure it isn't a bone injury, CAT scans, MRIs, ultrasounds, bone marrow autopsies, x-rays, bone scans, and PET scans can be performed. According to www.clevelandclinic.org, tumors produce a punched-out appearance on a bone x-ray. If this happens, the doctor should refer you to an oncologist. LCH affects 1 in 200,000 children. Children are not the only ones that can be diagnosed, but they are the most likely to be affected. Anyone at the age can be hit with Langerhans cell histiocytosis. Those who are diagnosed with LCH are typically between the ages 2 and 3 years old. Raina was only 21 months when she was diagnosed with it. That was when she was in the hospital and they were trying to figure out what exactly she has. A tissue biopsy is normally done to diagnose a patient. 80% of people affected have bone pain and swelling because they have one or more granulomas formed on the bone. This could lead to a bone fracture. 49% happen on the skull, 23% happen on the hip or the pelvic, 17% on the upper leg, and then 8% on the ribs. 15% of affected people, it may affect their lungs, liver, or the blood-forming system. Damage to these organs can be life-threatening. Raina went to the doctor on September 5th, and the doctor did a CBC, completed blood count. The CBC came back normal, but some inflammatory markers were elevated. They were concerned, so they wanted to do an MRI. When her parents got the results, they found some abnormalities, and so then the doctor wanted to perform a CAT scan on her. The CAT scan that was performed did confirm that it was a bone infection or something more. The doctors did more testings and they admitted her into children's. More testing led to them finding a lesion on her scapula. It was either a bone tumor or a bone infection. On September 10th, Raina was diagnosed with langerhans cell histiocytosis. Treatments depend on how severe langerhans cell histiocytosis is. In some cases, no treatments are necessary. For minimal treatment, steroids, anti-inflammatory drugs, surgical removal might be necessary, and also low-dose radiation might also be helpful. If langerhans cell histiocytosis is more extensive, chemotherapy and several drugs and combinations may be necessary. Raina goes through chemo. That was her first dose of chemo. She went through it once. She had to get chemo once a week until the 25th of October, and then they reduced it, and now she only has to get chemo once every 3 weeks. They took her off of her steroids that she was on, but when she went back to the doctor on the 25th, they put her back on it because some signs were showing up again. So she's back on the steroids. According to www.clevelandclinic.org, Cleveland Clinic Children's goal is to have their patients get through therapy as normal as possible. Raina, on the 12th, she went through surgery to get a port put in for the chemo. Anytime Raina gets sick, it hits her hard. She has been in and out of the hospital so much since the 30th of August. Anytime she runs a fever, she has to go to the hospital to make sure everything is okay. That was the 26th of October when she was in the hospital because she was running 103.2 temp. They tried to see if it would just go away, but it didn't, so they ended up having to take her into the hospital. But langerhans cell histiocytosis is not a fun thing to deal with for either the patient or for the parents. LCH is not genetic and it can happen to about anyone. Raina's family has no history of langerhans cell histiocytosis, and there is not a gene that causes the buildup of langerhans cell. Langerhans cell histiocytosis has affected this little girl, but it really hasn't slowed her down. She's still all smiles and everything. That was after she got out of the hospital. I mean, nothing slows her down. Raina is a tough fighter and still is as happy as can be on good days.
People behind you ask
questions. There are no people behind you.
and yourself.